Stone is about to take Mr. Edwards' blood pressure. To begin the process, he is going to select an appropriate cuff. Inside the cloth part of the cuff, there is a rubber bladder which you can feel. It goes about as far as he is currently showing. The width of the bladder should be 40% of the circumference of the patient's arm, so a little less than half. The length of the bladder should be roughly 80% of the patient's arm circumference, so it would almost completely encircle the arm. If this is not the case, then you would need to get either a larger cuff or possibly a small adult cuff. The next step is to find the brachial artery, which is just medial to the biceps tendon on the forearm. If you can't feel that, find the radial artery, which is located on the thumb side of the hand. You need to find this first in order to palpate the systolic pressure. Place the blood pressure cuff around the patient's arm about 1 inch above where you palpated the brachial artery. The gauge can also be repositioned for visual clarity. You can easily clip the gauge on the cuff where it is most convenient and easy to view during the procedure. For the next step, using either the brachial or the radial artery, find the pulse. Then you will proceed to inflate the cuff until the pulse is no longer felt. You will then continue to inflate an additional 20 to 30 millimeters of mercury. Slowly deflate the cuff and note the point where the pulse reappears. This is your systolic blood pressure. Give the patient about 15 to 20 seconds to rest before re-inflating the cuff. This time you will place the diaphragm of the stethoscope over the brachial artery. Support the patient's arm and inflate the cuff to about 20 to 30 millimeters more than the systolic you have palpated. Slowly deflate the cuff. You may hear a pause, but there may be more beats heard below the pause. The lowest number you hear, where the last beat is the diastolic. So, to recap, the first beat you hear is the systolic pressure, and the last beat you hear will be the diastolic. Evaluate the pressure to determine whether it is in normal range, hypertensive, or prehypertensive. The last step is to consult your patient and explain their results.